So let's just dig a little deeper in Jack's clinic. So at Jack's clinic, you can do physiotherapy, you can do chiropractic, and you can do massage therapy. You can do acupuncture treatments. You can do a registered dietitian. You can do cold laser therapy. You can do nutrigenomics. They do motor vehicle accident claims. They do virtual rehab. They do custom orthotics. They do PNF and mobility treatments. They do custom braces and rehabilitation. They do decongestive therapy. They do instrument-assisted soft tissue mobilization. They do personal training. That's coming soon. This was very interesting. A new thing that they started doing is they do IV therapy. So they hook you up to an IV, and they actually call it their new IV therapy lounge. They do the cold plunge therapy. Oh, sorry, that's coming soon. They do shockwave therapy. Also, apparently, they might actually help with Peyronie's disease, like ouch. And they do yoga, and they also, to make it so, this is the #1 chiro clinic, and they also to make it really, really convenient, they actually direct bill to 27 major private insurers, just to make your life much easier. It'd be interesting to see how many people do different therapies depending on how they come in or what they actually start off with. I don't even know, there's so much. I think there's more therapies than there are 27 major private insurers that they direct bill to. But where am I going with this? Because the story just got better. So under chiropractor, chiropractors are trained to assess, diagnose, and treat people affected by injuries, illness, disability with their spine, neck, pelvis, joints, nervous system, concussions, manual therapy, assistive devices, exercise prescription, education. Yeah, that's all good. Now get this. This is where the story gets better. Some clinics require that you get an X-ray. We don't. X-rays are only needed when they're absolutely medically necessary. Like, it sounds like this is like their unique selling proposition. Hey guys, we're not like those spinal reconstruction, spinal correction guys that actually get an X-ray. We don't use X-rays. If you're a chiropractor and you're a specialist, I want to see the spine. It's called diagnostic imaging. I use X-rays to diagnose, right? But they don't. And it's kind of this USP. Some clinics require that you get an X-ray. We don't. It's very interesting. I want to tell you a story. You know, I got Alan. Alan came in a couple of weeks ago, and his posture was brutal. Okay, his posture, he shuffles steps. He actually was so excited about being in their clinic that he showed up 3 hours prior to the report, and he took 3 naps. So literally the report was at, well, actually probably 2.5 hours. Report was at 10. He shows up at 7:30 in the morning and he naps. He's 89 years old. He can hardly walk. He's bent over, like super, super big, huge hump, anterior carriage, the whole bit, and shuffle steps. You can tell he's losing function to his legs. So poor posture leads to serious spinal degeneration. We know that, right? For every inch forward of head posture, the weight of the spine increases by 10 pounds, Kapanji, right? And then we just posted this, Hung Club Chiropractic, but if you punch in Hung Club Chiropractic, you're going to actually get to Jack's clinic. Why I call him Jack? Because he appears to be jack of all trades and probably a specialist in none of them. Just to let you know, that's why. But we're not jacks of all. So why I want to take an X-ray is because I need to diagnose. I need to prognose. I need to get a feel for what's exactly going on with his spine. So for every inch forward, an extra 10 pounds. Well, how many inches forward do we have? Like whatever, like 5 inches forward here. Is this serious? Well, is this serious? That's the question. Is this medically, clinically, or chiropractically necessary imaging? Absolutely. But it depends what you see. It depends what you do with it. It depends what you specialize in. We specialize in spine reconstruction, we want to see the spine because it gives us a massive amount of diagnosis. We can actually have an idea of this has been here a long time because there's bone remodeling. The disc, the beautiful disc, it's not because of his age. This is the 89-year-old disc. It's beautiful. This is bone on bone. It's not beautiful. It's serious. It's clinically significant. That's why we actually use clinically significant warranted X-ray, right? Why do we do that? Because we know that the loss of cervical curve, that the structural damage will also lead to eventually neurological damage. You can't have structural damage over time without having neurologic damage. In spine, in this specific area, progressive kyphosis of the cervical spine resulted in demyelination of nerves and neuronal loss due to chronic cord compression of the spinal cord. So what we know is we got massive amounts of extra pressure to the lower neck area. That's why his C5, 6, 7 being destroyed. We know that also there is progressive demyelination because of progressive kyphosis, okay? And kyphosis over time only gets worse. And we also know that, you know what? At this level of C2, the spinal cord rests in the spacious vertebral canal. However, at C4 through C7, the broadened end plates of the vertebral bodies have resulted in canal stenosis. We know that there's canal stenosis, but not only do we know that there's canal stenosis, we know that there's cord compression. We also know that there's a lengthening of the spinal canal. Therefore, we know that there's actually a tethering and a tensile stretch to the spinal cord. And it says here, this probably had clinical significance to the individual. I'm telling you right now, this is having clinical significance to Alan, okay? And this is from Atlas of Common Subluxations of the Human Spine and Pelvis. This is the first edition. It actually came out in 97, 98. We got the edition right off the bat. This is what changed the way we did things. This is what made us fall in love with, you know what? I can change curves. I can actually have an impact not only clinically from a mechanical standpoint, but a neurological standpoint from brain to body via brainstem and spinal cord. Billy, 10 years old, May 2021. She comes in and I can tell she had a really bad posture. She got checked because her mom wanted her to get checked because her mom started to realize that she had bad posture. Posture is the window to the spine. So is bad posture enough to actually justify X-ray? Absolutely, but it depends whether you do correction or not. If you don't even adjust the spine, then you don't need to see the spine apparently. But if you adjust the spine and do spinal correction, you have clinical significance and it's warranted to take an X-ray. Billy came in without any symptoms, just bad posture. I took an X-ray. I'm going, hey, mom, look. There's a kyphosis happening. What we know is, like, you know, for every inch forward, like, so she's a 1.5, 2 inches already at the age of 10. She's got an extra 20 pounds. What I can predict, prognose, mom, is that if she doesn't have any pain right now, but I guarantee you she will, and she will over time. But I'm more worried about the structure leading to neurological problems, because what's going to happen is that with this reversal, is I can predict that C5, C6 is going to get blown out with spinal degeneration, spinal remodeling, which is going to, right now, there's already tethering to the spinal cord at this point because of the kyphosis. And over time, there's going to be a demyelination of the nerves and neuronal loss. Okay. Well, doesn't start care. Billy, 11 years old, October 2022. Now she actually has symptoms. She has massive headaches, massive neck pain, and full spine pain. And this is a year and a half. She's gone from a 26 millimeter anterior carriage to a 40 millimeter anterior carriage. And what we see is the kyphosis got worse. So now what we know is that what she's going to do is head from a reversal as a phase 1 into a phase 2. And what we're going to get into phase 2 is note that the pons and brainstem are tethered against the posterior surface of the dens and transverse ligament. Introduction of any flexion, i.e. if you increase the kyphosis in the vertebral column, this will cause further tethering. So she's gone from tethering in 2021 to further tethering in 2022. Increased interspinous space indicates lengthening of the canal. Advanced disc degeneration is evident at the most subluxated and structurally stressed part of the cervical spine. With the reversal, we know this is a load moment. It's the most structurally stressed spine from a biomechanical standpoint. C5, C6 is going to blow out over time, guaranteed. Okay. Leah, so it depends what you see, right? Leah, 15 years old, she comes in and is like, yeah, she's got a little bit of a start of a kyphosis. Her symptoms, massive amount of symptoms. She has Tourette's syndrome. So Tourette's syndrome, she comes in and she gets referred in from somebody who said that Dr. Quirk actually might be able to help. When I see Leah's spine, what I actually see is Serena. Serena had Tourette's syndrome. She couldn't go to school or play with her friends anymore. And the reason why is because as a 7-year-old, she was diagnosed with Tourette's syndrome, depressed, and no longer in school. As a 7-year-old, she actually was on antidepressants because the Tourette's syndrome was so incredibly severe. Now, don't believe me, you can go watch the video. Okay. And then in the background here, you can actually see her post x-ray here with a beautiful curve, and she doesn't have Tourette's syndrome anymore. But this story actually is even better, because how Leah got referred in is because here she's 7 years old. Now she's in her mid-20s. She works with Leah's mother. So Serena, who works with Leah's mother, is the one that said, hey, I used to get Tourette's syndrome. It's because I had this reversal in my neck. I got my curve back, don't have Tourette's syndrome anymore. You should go see Dr. Quirk. So that's what we see. So it all depends on how you use x-ray, how you diagnose, how you prognose, and which your outcome measures. And if they are spinal reconstruction, your post x-ray, your pre x-ray, if we were in a surgical realm, people would be all over this. Right? But apparently over 50% of chiropractors in Canada don't want to see x-rays, and over 50% of chiropractors in BC apparently say that chiropractors shouldn't be seeing x-rays. It's ridiculous, because what I see, okay, is I look into the future and I can actually use x-ray in March 2022, and I can see Serena's story. I can actually predict what I'm after. I can tell whether it's fully correctable. I can tell the timeline and the prognosis. I can tell what's happening structurally. I can tell what's happening to the spinal cord and the nerve system as we get the curve back. And from March 2022 to September 2022, things are better. And not only that, is actually Leah has now decreased between 40 to 50% actually of Tourette's syndrome. Why we do this is also because I know exactly how to actually, lower the tractioning, but it turns out she hasn't been tractioned because when she has her Tourette's episodes, it's hard to stay on the tractioning. So we modified the tractioning. We're going rolled up towel, which is much more comfortable in the lower neck area. It's a very, very hard towel, and we're getting amazing change, 40 to 50% decrease in Tourette's syndrome. Amy, April 2009. Okay, so I was just reflecting on this. I've never not taken an x-ray on somebody, though. If they're pregnant, I don't, but as soon as they deliver, I do. And if they're over 4 years old and they have bad posture or subluxation or something I found clinically, I'm going to want to take x-rays structurally to see the structure, because I could diagnose and prognose, and I can tell the timeline of correction it's going to take, and whether full correction is even possible. This is Amy, 2009. Amy, you got a reversal. That's what's causing your neck pain. Amy, your reversal is worse on C5, C6. Amy, that's stretching, lengthening the spinal canal. Amy, that's stretching your spinal cord. Amy, it's causing tethering of your brainstem area. Amy, as this blows out, you're going to have major symptoms in the neck, head possibly, and for sure, usually the arms. Amy, you should start care. We need to correct this. She doesn't start care. 2 weeks ago, she comes in with her, can't move her neck. Okay. Haven't seen her in 14 years. Can't move her neck. Okay. She's holding her the arms are up like this, totally disc bulge symptom, right? She's stretching. She's holding her neck, walking around like this, can't move. She's bawling. She's got 3 kids now. April 2009 to October 2022. So what's happened? Further kyphosis, further tethering, further structural damage, further remodeling, further spinal stenosis. Look at this. What blew out? Well, 5-6 blew out. Okay. 5-6 blew out now. 15 years, 13 years difference. Look how much damage. What phase 1 to what phase would you advance? Phase 2 will be soon into a phase 3 at that specific area in 13 years. Now, the reason, okay, you can't know about X-ray if you don't take X-ray. You know, we actually we adjust all of our patients by looking at their X-rays. So the docs at the clinic, we look at hundreds of X-rays actually a day because of the amount of adjusting we do. We look at hundreds of X-rays a day, including all of our new patients. And we've been doing this for 25 years. Or going into 25 years of spinal reconstruction. We've seen thousands and thousands and thousands of X-rays. And that's why we take X-rays, because we're able to diagnose, we're able to prognose, and we're able to get correction, and we're able to change people's stories. Because if not, this is what Amy looks like, okay? We got the tethering, we got the stretching, we got the compression, we got the stenosis. And if this is not corrected, down the road, she's gonna look like Alan. And that's why we take X-rays.